Getting old is inevitable and definitely preferable to the alternative. But getting old doesn't mean having to get infirm. So what's the secret to healthy aging? Our guest on this week's Health Talk, a boarded geriatrician and internist, will give us some healthy and important tips. So stay tuned, we're up next. Hello, I'm Dr. Eric Mazur. Today we're going to discuss healthy aging, a topic in which I have a very personal interest. Our guest is Dr. Amber Brody. She's an internist and a geriatrician with the Wilton, a primary and specialty care group in Wilton, and actually a new member of our community, only here a year.
Yes.
Amber, welcome to Southern Connecticut. Welcome to Health
Thank
Talk. It's
you.
so good to have you.
Thanks. It's wonderful to be here. I appreciate it. Thank you.
Okay, as a young and healthy woman, and as an aging American overweight adult, tell me, what are the secrets to healthy aging?
I'm glad you asked. Oh my goodness. I get this question quite often, as you can imagine. My practice, my patients are, and the majority are over the age of 75, I will say. If I have a 65 in the office.
75 is beginning to look very young to me.
Absolutely. 75 is very young. This is true.
It's the new 50.
It's the new 50. Yes, exactly. So I have a lot of older patients, mostly in their 80s, 90s. Unfortunately, I rarely see the 100-year-olds. I did get to meet one of the eldest men alive.
Really?
Back in the day. I have his autograph. He made it to 116. You know what? I did interview him on healthy aging, actually.
Oh,
If I could find the tapes, I should have looked back on them, but I do recall a few great things he told me.
yeah, I'd love to hear. 116 looks way, way off and pretty much impossible, but
I'd
I'd like to aspire to it.
It was a very interesting conversation he and I had. And he gave me a few tips. One of them I rarely share with people because I don't personally agree with it. He told me, don't have children.
Oh my God, it's too late.
I was like, what? And then I thought back on that and I decided to do a little growth and inspiration and see where he was coming from when he was telling me this. Now, mind you, he, at age 116, had a small amount of dementia, but he definitely was able to have a conversation with me and explain stress. And he came out and said, stress kills. And children cause stress. And I said, well, if you didn't have children, how do you know? He goes, oh, I have plenty of nieces and nephews. And so I decided to think about this a little more and say, well, what does stress do? So this is a great topic because stress does not only lead to aging along with time, but it worsens health.
But stress is so much a part of our everyday lives. In almost every way, and now we're in the midst of a COVID epidemic, which certainly has added to everybody's stress. We are 6 feet apart as we sit here, being socially distanced.
Yes.
So, how does one? We're not going to avoid stress. Let me just push back on having children,
yes.
though. I will say, as someone over 70 with grandchildren and children, they're part of the greatest joy of my life at this point in my life.
Absolutely.
In fact, I find that I appreciate family in a way that I didn't appreciate it when I was busy, younger, building my career and trying to earn a living.
Yes.
So I find that almost antithetical to advice that I say, which is have a family that you love and that loves you and engage with them as you get older.
And create healthy relationships and use your family to deal with stress and deal with talking about things that
because
create
isn't
stress.
Emotional distancing part of age? You get isolated as you get older, and
which leads to more dementia. Absolutely. So I think there's a few pearls to take home there, and absolutely, you brought up the importance of having a family, the happiness a family brings, the smiles that family brings, the love. Those are all good juices for the brain that help and prevent dementia.
I have 5-year-old twin grandsons, and I will say I had sons. I have 2 sons.
Yeah.
But I never appreciated how cute little boys
Oh,
are
I know, I know.
until the grandsons. Because when my
Yeah.
kids were little, I was busy doing a residency and a fellowship
Yeah.
and all the things that you're familiar with.
Absolutely.
And so it's a great joy. In fact, I think one of the
Absolutely.
sadness, I don't want to editorialize, but one of the sadnesses in our country is how often families are split apart and
Yes.
spread across the
Spread
country.
across a very large
So it
country.
becomes a Christmas and some-
Weddings, funerals.
exactly.
Right.
And I think that's sort of sad because
It
my
is.
family's close together, and it's a great, great joy every day of my
Absolutely.
life.
Which brings up another point. Aging with your family near always promotes a healthier outcome because you're able to say, okay, I'm 90, but my daughter is 5 minutes down the road. Honey, I fell, I need help. Or, honey, I can't get to this. Or you have your social support, and that is so important.
And maybe you could tell us a little bit more about the relationship between your state of mind and physical aging, because it's not simply that, it's much more than, well, if I'm not stressed or I have love in my life, I'm going to be happier while I live. You actually do live healthier. There's a lot of evidence about
Yes.
dementia and other aspects. Let's tell us more about that,
Yes.
because this is not just hocus pocus. This is real life illness and health.
Very true. Yes. So your mental health and mental well-being. Ironically, I am married to a therapist, and so I hear him talking to his patients every once in a while. I can kind of hear, as you know, because of COVID. Now he's working
from home.
working from home, so he has the doors shut. But if it's ever quiet enough, I can hear him helping and discussing things with his patients. And sometimes I see myself doing that with my patients. And a lot of what I do ends up being mental health. Not only am I helping with blood pressure, blood sugar, I'm also dealing with the social aspects of aging. The sons bringing the father in who is now older and no longer able to take care of himself, or just starting to be more forgetful. So the mental aspects are also important when people ask me about memory. The mental health of making sure to continue to read books, do puzzles. There's websites for this. I know Luminosity is a great one. And when people stop using their thought processes, and another part of aging is input, right? Input and output. So if they can't hear that well, they're not getting as much input. So the output is less. And
So this is where real, it's like your muscles. Everybody's heard this, but it's real. Use it or lose it.
Use it or lose it.
So exercising your brain. I know, from what I understand, some of the specific products that are out there, there's not a lot of evidence, but the general evidence is pretty strong that those who remain engaged, thoughtful, challenging themselves.
Socialized, yes.
So tell us more. So I'm, not I now, but someone's approaching 60 or 65. They say, I really want to live the rest of my life as a senior citizen in a really engaged and dynamic way. What specifically should they do? We'll talk about mind and then we'll talk about body, but what do they do for them? And then some of them go together. But what do they do for what should they be doing for their mind very consciously?
Well, keeping busy is important. I was doing a lot of reading about aging and longevity. And have you ever heard of the blue zones?
Yeah.
Where the people live the longest. If you look on the earth on a map, where do people live the longest? There are several languages that lack the word retire. These are the people that live the longest. They also don't have elevators. They're using the stairs, right? They're not going to the grocery store. They're working in their garden. These are the secrets. And so it's important if you're in your 60s, mid 60s, thinking about retiring. It's just people, and I've heard people say this to me in the office. They say, I don't want to just sit down and die. I'm going to keep working. And I'm like, yes, that's the great attitude. Because like you said, if you don't use it, you lose it. So if you are going to retire, you just have to have a plan. What are you going to do with your retirement time?
I have faced this. I retired 6 years ago. And what I found is a need to fill that time with other things that I enjoy, other things, including intellectual things.
Absolutely.
And you need that. I find that I need that.
Oh, yes.
Just to keep my day entertaining.
You have to. You have to have goals set. You still have to have a healthy amount of stress. We talked about stress. There's good stress
So
and bad
it's
stress.
really, you want to maintain your engagement with the world, your mind
your
engagement.
connections.
But I will say, for folks at home, the nice thing about retirement is I can do it on my terms.
Yes,
That's the difference. The difference is, on a Monday morning, if I've stayed up late, I can sleep late on Monday morning.
What a concept.
You can't.
No, that's it. Get up and go, go, go.
But beyond that, it's just so, I have found I absolutely need to engage with my professional society, with ideas, et cetera. So it's
very important.
But
absolutely.
Physically, let's talk about, and everybody says,
let's talk about exercise.
Now, we've had somebody, Dr. Levine, who is a neurologist here. I think he's retired. He wrote a book called Aging with Attitude, where his postulate was, all you need to do to keep your mind healthy is to exercise. So he believed that it was almost a one-to-one relationship. But I know there's definite evidence on that, the physically active person is also mentally protected.
Mentally protected, yes. They've done a lot of studies on dementia and keeping the brain healthy, and they're able to point to cardio. And then you have to think about also how much cardio is enough. I have people say, oh, I walk 3 miles a week. I'm like, okay. And you have to get that heart rate up, right? For extended amounts of time. They say, a minimum of 30 minutes, 3 or 4 days a week.
But you don't have to be in the gym sweating like the big muscle-bound teenagers.
Right, just get that heart rate up. That's the important part. Several of my patients, they say, oh, I do the treadmill, but I put it up on an incline. They do simple things to get going. Even if it's, I have a couple that they got a puppy in their 80s.
That's good.
Keeping them busy, let me tell you.
But that's both mind and physically.
Yes.
Now, we have less than a minute on it. There's so many more things I want to ask you.
Yes.
But in the final 45 seconds or so, tell somebody who's getting into their 60s, the 3 or 4 things you definitely should think about.
Oh gosh, optimism, remaining positive, you have to. So it's all about attitude, right? And socialization. Nowadays is difficult, but maybe in the near future we can all be more social.
That is really important. Having
oh my
friends,
God, yes.
Maintaining friendships.
Yes, maintaining your support system. I'm a huge fan of cardio. Obviously, weight-bearing exercise is great, but we're a biking family.
And a final thing?
A final thing is love yourself. Okay. Take care of yourself.
So it's not bad to get old.
Absolutely not.
I wish we had a whole other hour to discuss this. I have lots of other questions, but unfortunately we've run out of time. I want to thank Dr. Amber Brody, my guest today, for coming on the show. So if you are interested in communicating with us, please share your questions and comments with Health Talk at nuvancehealth.org. That's NUVANCE.org. Thanks very much. We'll see you soon.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
Urinary tract infections, or UTIs, are very common, particularly in the elderly and much more so among women. On this week's Health Talk, we'll discuss the symptoms, the diagnosis, and the treatment for UTIs with Dr. Amber Brody. So stay tuned to Health Talk. We're coming up next. Hi, I'm Dr. Eric Mazer. Today we're going to discuss UTIs, or urinary tract infections. My guest is Dr. Amber Brody. She's an internist and geriatrician with Wilton Primary and Specialty Care. Also a new member of our medical community. If I guess a year is still a new member.
Yeah, absolutely.
So welcome to Southern Connecticut.
Thanks for having me.
So urinary tract infections. Well, it's probably one of the first things we learn about in medical school.
Yes.
It's one of the things we probably overdiagnose. So,
yes.
In terms of, as an intern, if you have a patient with a fever, you want her to have a urinary infection.
Absolutely, yes. Altered mental status.
So what are we talking about?
So we're talking about, let's see, things going in the wrong direction. So I like to, I forget who described it to me one way, but it was a great explanation, right? So we stay healthy by pushing things out, right? So we have tears in our eyes, we have wax in our ears, we have saliva in our mouth, we have urine to go to the bathroom to clean out that part of our body. So hence why if you don't go enough, you didn't clean it out enough, and people will get UTIs by the bacteria growing up in the wrong direction.
So what we mean by UTI is bacteria that have gotten into the bladder, into the urine, and are infecting the bladder, and we can even talk about whether they're reaching a little bit higher. Just for the folks at home, our anatomy is that we have kidneys sitting sort of back here to clean our blood. They produce the urine that then drains down through two tubes into a storage device.
Area.
It looks like a balloon.
And then
it goes out through the urethra.
Yep, exactly. Very simple.
Very simple.
Simple anatomy, and for women, it's always something of concern.
Right, and it's not magic. It's that their urethra is a
just
lot shorter.
Anatomically smaller, yes.
The men have a hose there that protects them.
Exactly.
And the women don't.
Exactly. It's just the anatomy, the way it's set up. So it's something that actually we, even if you look at pediatrics, when 2- and 3-year-old females are learning to potty train, if they have a small accident in their underwear, that can cause a UTI. It's simple anatomy. You rarely see it in males. So
yeah, we can maybe talk about that at the end because because it really represents. It's much more abnormal for a man to get a UTI than a woman.
Exactly.
But for women now, people think of kidney infections. Those are very different than typical. Call it cystitis or a bladder infection, which I think most people is the common way most of us think of a UTI. Do you want to just sort of explain the difference so we're all talking about the same thing?
Yeah, absolutely. And the way you described it, you could describe the urinary system from the top down or from the bottom up, but for simplicity purposes, the bacteria try to make their way up, and they'll come in through the urethra and hang out in the bladder. And if this is not treated, they can continue to go upwards. And in order to get to the kidneys, you have to go through the ureters and then up to the kidneys, one or the other. These are worse infections, pyelonephritis. You will have more systemic symptoms, usually a fever, fever, chills, back pain, abdominal pain and pressure. And sepsis is the ultimate endpoint when the bacteria makes its way.
Some people think of it as blood poisoning or bacteria
into the blood. Yeah.
But most urinary tract infections pretty much just involve the bladder. Is that right?
Absolutely, because those are symptomatic. You get patients with urinary frequency, urgency, burning. You sometimes will get the lower abdominal pain and pressure, and every once in a while,
because the lining of the bladder, which literally is like a balloon, gets irritated. Irritated. It's also a muscular organ, and when it gets irritated, it tends to get twitchy.
Yep.
So you feel like you got to go all the time.
Gotta go. Yeah.
A little bit of stretching, and it wants to get rid of it.
In the middle of the night, gotta go. Yeah. But these are important symptoms because these will save your life. I do a lot of reading on evolution, and bladder infections are what would ultimately be the demise of, say, a cave woman. They didn't have antibiotics. And you have to keep in mind we have symptoms for a reason. So if you have symptoms of urinary frequency, urgency, burning, every once in a while, low-grade fever, you have to get that checked out because it needs to be treated. Ultimately, without antibiotics, these rarely go away on their own.
But we can talk about treatment in a moment, but are there things you can do? I know there are things you can do to prevent the urinary infections.
Yes, excellent question.
Other than sex change operations.
Absolutely, yes. If you're stuck as a woman, you have to know the prevention, right? Obviously, staying hydrated, keeping that flushing mechanism going. I see another important one is don't hold your bladder if you have to go to the bathroom. I often see myself during patient hours not listening to my own advice. So I understand we get busy with life and work and things happen, or you're on a train, you're on a plane, you're in a car, there's certain things that don't allow you to do that, but really have to make it a point to go to the bathroom when you have to go to the bathroom. Obviously, a major culprit is sexual intercourse, especially for women. It's very interesting. You have to keep in mind, go empty your bladder prior to and after sexual intercourse, because that will keep the area clean, and 9 times out of 10, you don't have to worry about a UTI then. But hydration is so important. Mm-hmm. Another big one is avoiding sugary drinks. If you drink too much sugar, you will get rid of the sugar through the urine. And if there's bacteria in your urine, they're going to eat that sugar right up, and they will grow.
There's some diabetic drugs that actually push sugar in your urine.
Push sugar out, yes. So that's also, it's a very interesting concept.
Now, how about for a while, and I don't know whether people still recommend this, drinking acidic juices like cranberry juice or things like that to sort of make the bladder, the urine less hospitable?
Exactly, yes. So we're talking about the cranberry juice, right? But we're talking about cranberry juice, not cranberry juice cocktail. So we don't want a mixed drink here. We don't want the apple juice mixed with the cranberry, mixed with water, you need to actually get a juice that's just cranberry, and it's usually a very not palatable flavor. Yeah. So I tell my patients, especially if they're using it for preventative purposes, to water it down, because then you can really get it in. Otherwise, if you try to drink it alone, it's very difficult. It's very acidic.
Do you ever have them check the acidity of their urine themselves?
Oh my gosh, no, I never thought of that.
No, I didn't know that's something people ever do.
Litmus paper, how cheap can you get, right?
Also, I've heard about wiping for women. Is that a genuine?
Yes, so it brings up the pediatric issue as well. When you see pediatric girls potty training, sometimes they wipe in the wrong direction. Hence, we don't bat an eyelash at a 2 or 3-year-old or 4-year-old having a UTI. It's very common. But we also have to think about our special needs individuals and people who grow up and still are wiping in the wrong direction. Most of the bacteria in our body comes from us, and it has to stay in certain areas, such as the buttock area. If you wipe that bacteria forward, you're setting yourself up.
This came home to me. There was a paper years ago, I think I was an intern or resident, that talked about women with chronic yeast infections of their bladder. And yeast is a little bit different than bacteria.
Yes.
And it doesn't usually live
in those environments.
But what they found is that the women actually had it in their intestines. Yes. And that they could prevent that recurrent yeast infection by treating, you probably know this, but treating the yeast orally in the intestine. If you wiped it out there, they stopped getting the urinary infection. So it really sort of brought home to me how much of this is you're not getting it from the outside, you're getting it from
yourself, yes.
And in fact, the bacteria that infect the urine are the same ones we find in the stool.
In the stool, absolutely, yes. I had a patient say to me, oh, I have to stop getting that E. coli when I eat at that fast food restaurant. And I was like, no. And I had to explain, this is E. coli coming from the feces. So we have to be a little more careful down there. Another thing is, as we age, we sort of go backwards, right? The bell curve of life. So our patients end up with incontinence issues, not only of the urine, but also of the feces. And then we see a lot of UTIs, not only in women for obvious reasons, but also in men. So we get different organisms, and they're always organisms 9 times out of 10 that come from us, from our bodies, versus nursing home acquired UTIs, sometimes you'll see different organisms. There's so many out there. It's so interesting, the cultures we can do and see what grows.
And then we have really a whole panoply of antibiotics today.
Thank God, yes, absolutely.
Now, we don't have a lot of time left, but how about for the women who get recurrent UTIs? They're doing all the right
Doing
stuff.
Everything, yeah.
What's sort of the next step for them?
So the next step, we always ask a urologist to do a full workup. Sometimes cystoscopy is necessary, urodynamic studies, sometimes ultrasound to get a post-void amount, right? How much is coming out and how much is not? Are we dealing with a bladder dystonia versus an overactive bladder? There's urology
stone in the kidneys.
Absolutely.
Can be horrible bacteria that are hard to get rid of.
Yes, there are. The field of urology is quite amazing. And little tidbit, it's one of the first surgical subspecialties.
Well, they didn't know that.
Quite interesting. They came up with their own tools and their own ways of measuring things.
We have actually less than a minute left.
Okay.
The last thing I wanted, we talk about asymptomatic bacteria. This is something meaning you've got bacteria in your urine, but you don't have symptoms.
Right.
What's the modern thinking about that? Is that an infection? Is that just normal? What do we do with it?
So excellent question, and there's still a lot of research on that. Right now, we are technically not supposed to treat with antibiotics anyone who has asymptomatic bacteriuria. It's common to have a small amount of bacteria in our urine, or maybe it's a contaminant when you went to the bathroom in the cup incorrectly, you didn't get a midstream catch. It depends on the colony count and quantity of bacteria in the urine. So we're still...
This is really most of them are nursing home patients and the
elderly.
Yeah.
If they're asymptomatic, we really don't treat it. We expect it. But we have to look at what are the symptoms of UTIs. And when you have someone who's unable to tell you symptoms due to having dementia, then we are dealing with having to find other symptoms, right? Fever, altered mental status, patients who can't speak for themselves. Then you would treat it.
So that's unfortunately, that's all we have time for. I think it's really a lot of practical advice. It's common in women.
Very
common. We haven't
common.
even talked about men. We'll have to get you back to talk about men.
All right.
But it's common in women, but there's a lot people can do about it, and you're not abnormal if it happens to you.
Oh.
But you're not even unclean if it happens to you.
Absolutely.
So
Part
we're
of
out
living.
of time. I want to thank my guest, Dr. Amber Brody, for joining us on Health Talk today, and thank you for watching. Please share your comments and questions with us at healthtalk@nuvancehealth.org. We'd love to hear from you.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.